All right. Hi, everyone. Thank you so much for tuning in. Today, Dr. Tim and I are going to be having a very insightful conversation. We hope you'll watch through until the end. But before we get started, maybe we'll just start with very quick introductions. Dr. Tim, would you mind going first, please?
So hi, I'm Dr. Tim Wainer. Right now, I'm a family physician in the Bronx. I'm also owner of a practice called Rehab View and creator of an app called Rehab Pro. This summer, I'll be starting my sports medicine fellowship and will be team physician at the University of Connecticut.
Amazing, amazing. And hi everyone, I am Dr. Larissa Assam. I am a family medicine physician as well. I am based in the DMV area, and I'm also the founder of a concierge medicine practice called Rofi MD. So today, Dr. Tim is going to be taking us through a bit of a story time, but I think there are lessons that we can all learn from the story he's going to share. So I'm going to ask a few questions, and we're going to go back and forth and pretty much just have a conversation. So this, I believe, is going to be applicable to patients, but also to physicians. So without further ado, let me ask you this, Dr. Tim. So, did you, if you've ever had a situation in which you've had to take care of a young person, an active person who had a life altering diagnosis, what challenges did you recognize that came with caring for someone who was young, active previously, and then ended up receiving this life altering diagnosis?
Yes. So actually, pretty recently, I've had a patient that was a professional athlete at the end of their career. They were doing well in the sport. They're very popular, and then all of a sudden, uh, over a span of 3 months, they start getting more tired and more fatigued, and they don't know what's going on. So they ended up coming to my hospital, and this was my first time meeting them. Ended up taking care of them. Uh, ended up finding out who they were, the impact that they made, what they were doing with their career. We were able to actually bond over that because I used to play sports as well. And I found that the problem was for this patient was accepting the diagnosis. Like, can you imagine being a very fit, very active person? In fact, inspiring others to be fit and active, and all of a sudden you can't move your body. You can't take a few steps without being short of breath. And what makes it worse is being the provider to tell the patient that the reason you're having all these symptoms is cancer, and this is what cancer looks like, and this is what we have to do. So that was a situation I faced, not only them accepting it, but trying to help that patient. But what I found, it was a very great learning case because I think having the background of an athlete, I understood what it would mean to me if I couldn't move. And we were able to relate and come to the commonplace with that. Like, I kind of, with this patient, challenged them. Like I knew they were athletes, they had a competitive spirit. So I was like, okay, here are our goals, for the first few weeks. Then these next weeks, you know, that worked a little bit, but we still had our challenges. So that was a really interesting case. And it shows that, you know, young people, active people, aren't immune to getting a life changing diagnosis. It can happen, and it was a great learning case for me, and it changed my career and my life as well.
Wow, that's powerful. You said it changed your career and even your life. I feel like we all have some of those like patient encounters or stories which really do like shape how you continue with the rest of your career. Like you kind of never forget about certain like patient encounters, and that's powerful that that was one of them for you. And I like what you said about trying to relate to the patient, you know, like using the common thread, you guys both being athletes, playing like the same sport, and using that to connect. Because I think that sometimes as doctors, like people just need to know like we're human too. And I think it's helpful to connect in that way more when they're able to remember, like, oh, wow, like, okay, my doctor played basketball too. Like, he knows how this thing goes, he knows what the mindset is. And I'm sure, I would imagine that it made it easier for him, I hope, to also be able to connect with you and even open up. Um, were there any additional challenges that, you know, maybe he expressed to you or that even on your end you expressed that were hard or you experienced that were hard, you know, with just even having to share that? I think we don't talk about that part too much. The fact that no one wants to be the bearer of bad news, you know? What was that like for you?
Um, the hardest parts, I'll say the family dynamic, because there's always this saying that it's not only the patient that gets a diagnosis, it's the family that gets a diagnosis. Especially if that patient has spouse, kids, you know, you kind of have to break the news to them. They're probably asking, the family's asking you more questions than the patient, than themselves. And you're in a sense treating the family as well. At least answering all their questions, telling them what treatment will look like, what the pathway will look like. Um, so that was the biggest challenge for me. And then it was follow up. You know, getting a tough diagnosis like that, it was very tough to accept. And sometimes patients may want a second opinion. You know, sometimes like they may not want anything to do with your hospital anymore, or they want to go somewhere else. So getting that follow up as well as tough. But I'll say family. Um, Making sure that the family is okay with the diagnosis, they understand. But I don't know your experience. Uh, what was the toughest for you?
Yeah, I think I'm glad you brought that up. And I think it's very interesting, especially literally the name of our specialty is family medicine. You really do end up treating the entire family unit. Um, and I think that when I think back, when I was in medical school, I shared a cancer diagnosis for the first time with someone who I didn't know before, but the approach I took with him was just to sit down and just chat with him and ask him what his life was like. I knew what I would need to tell him, but no one else on the team really wanted to do it because, understandably, so no one wants to be like the bearer of bad news. But basically, I just asked him about his life, and essentially, in that conversation, he shared that he had been like this famous artist, like he had traveled across the world, he had worked with all of these different people, but had a really lovely family. So when I ended up telling him the diagnosis, he was a bit surprised. But I kind of explained how the symptoms were related to the diagnosis that I was giving him now. He was like, wow, so that's why I've been feeling this way this whole time. And then I asked him, like, do you want me to talk to your family? Because it can be a bit overwhelming, especially as something as serious as a cancer diagnosis for a patient to even explain to their own family members. And I think that's why we end up getting involved so much with the family because they genuinely need like the help and the explanation and the support. And so we put them on the phone, and it was a couple of them, at least maybe three or four, who were on the phone, and they all had questions. But it was a very good conversation, I think. Tried to answer to the best of my ability. At the time, I was in med school still. And so, yeah, it was a good, it was definitely here we are several years later, but I still very much remember it. So it was definitely a life changing experience. And I think one thing I tried to encourage him to recognize was that he was he had lived a really full life. Of course, no one wants to hear this
Yeah,
diagnosis anyway. But in his case, he had really, I was like, wow, your life is really interesting to me. You've been able to accomplish this and that, and you have this great family. And just remind him of a lot of the blessings that he had lived through and witnessed. I think that in that case helped. But bringing it back to you, I do feel like when someone is younger, it's trickier because it's like they recognize they have all of this life ahead of them, but then here they are with this diagnosis.
yeah. No, yeah. I feel like I got practice with it with young people, with athletes, and life changing diagnoses. Like for example, you have such a severe knee injury that you can't play your sport anymore. Like, can you imagine athletes? Their identity is I'm an athlete.
Yeah.
I breathe athlete. Like everyone knows me as the town basketball player.
Yep.
I'm going to the NBA. This is all I am.
Yes.
And now there's a major injury, and now you're telling them that your identity is no longer and that's a big part of sports medicine. And I think it was an easy transition taking that over to patients with cancer.
No?
Um, Understanding how people are tied to their identity, how things may change. Um, the strategies with that, I think, first meeting where the patient is, where what their understanding of the diagnosis is, educating them, and then just being supportive and knowing that it'll take time, it'll take multiple visits, it'll be a process,
Yeah.
but just providing that support as they go through that journey.
Yeah. That's really good. I was gonna say, is there anything in addition to that? Do you ever have to help them with reframing their identity? Especially if, like, I know some people who it was sports or nothing. Like, there was really nothing else they were interested in, right? Like, is there ever, what does that look like?
Yeah, for me, I was like that. Like
Oh,
when I
wow.
was in middle school, high school, you couldn't tell me anything. Like I was going to the NBA. My parents still make fun of me to this day that like where's your NBA bag? So I with the younger crowd, like I totally understand that, and I always share my story. You know that junior year of high school, the coach said if you're not 6 feet 3 inches, you're not playing Division One. You're not going to the NBA. And a lot of us sitting there, we had to all rethink everything, and it was okay. And it worked out.
Yeah.
There's more to life. In
Yeah.
fact, all your favorite athletes, they do something afterwards, their career eventually, and so um, yes, and I take that over when it comes to cancer diagnosis.
Good.
So that everything will be okay. This is just a new identity. This is a new phase.
Good. I'm gonna start using your story as well.
Yes, yes,
these,
yes.
these conversations. But how else, in addition to definitely listening, encouraging them, and also even, I dare say, setting realistic expectations, right? Um, how can we best serve these athletes or other maybe high profile people, whatever the case may be? I'm even thinking of doctors. I know surgeons who had, like, I know someone who unfortunately ended up developing an autoimmune condition and it affected her hands, so she couldn't operate anymore. Um,
She's the one that wrote the book on contracts. She's a black
I'm
woman.
wondering. Yeah, yeah, she's
Okay,
she's maybe we know the same person. Yeah, like she's a black lady.
mhm.
But actually, I know two of them. I know one who was ortho and another who was plastics.
Ortho. The one I'm talking about is ortho.
She was ortho. Okay, yeah, she has like a low cut. Assuming we're
Yes,
talking
yes,
about
yes.
the same.
I think mhm.
I'm totally forgetting her name, but basically, I feel like she really reinvented herself.
Yeah, yeah.
Um, but any other like things that you think over the years? come to mind that we should think about how best we can support people, what services we can provide to them, how we can support them.
Yeah. And I think this is the beauty of family medicine. You know, we're always not just looking at one diagnosis or one body part, but the whole. You know, and we're so used to training, like for example, somebody has stomach pain. We're always considering the social, you know, the stomach, the heart, like every organ system, and even we're so used to patients coming with different things that we're well equipped to handling things like mental health, shoulder pain, knee pain. So with that, so if someone has like a diagnosis, life changing diagnosis, I think we're equipped as family physicians to offer the mental health services. In fact, there's actually a big topic in sports medicine called life after sports. It's actually
Ah,
a very well studied part of sports because that transition is very hard.
huh,
And I can, and it's using that, it's very easy to apply that to other
yes,
life changing diagnoses as well. But and a big part of it is, you know, sending them to therapy, you
yeah,
know, finding therapists. I think that's a huge part.
yeah,
Um, so yeah, or if they open a medication. So yeah, I think
yeah.
we're very well equipped in that field.
Wow, life after sports, that is absolutely necessary. I remember I used to watch a show a couple of years ago. I don't know if they did all athletes, but certainly football players, and they would talk about what their lives actually were like after they had played the sport. Uh, I'm totally blanking on what it was called, but it was very interesting because there was such an array in what people ended up doing after they left like professional football, or professional sports more broadly speaking, and that is definitely an important conversation to have. And I think even for us, as we continue to serve our patients, just even dropping little seeds as time goes on, I think is important just so that it's not like a shock, like, wait, I've come to the end of my career. What are we doing again?
Yeah,
But just like leveraging like the time and the relationship to be able to start to have some of those conversations. But huh, that's really eye opening. At one of the things that we have at Rofi MD is the Crushing Cancer Protocol. And the idea with it is we take a holistic approach and we're able to, in addition to chemotherapy, radiation, surgery, there are a lot of other things that are extremely helpful with treating cancer and really trying to reverse it. And so we look at diet, we look at nutrition, we even look at people's spiritual life, right? For some people, you need to get to the root of certain things, whether it's looking at your heart posture, forgiveness, bitterness, things like that. Unfortunately, without realizing they can affect how you're doing, what your health is like. And so for anyone who might be listening to this who is currently going through a life altering diagnosis, whether it's something like cancer or any other chronic condition, whether it's autoimmune, there are several protocols that we have available that can help you and really help you take care of yourself, not just with medications, but really looking at you holistically, your body, your soul, your spirit, all of that really, really matters and makes all the difference, I think, when it comes to even addressing this. I'm thinking he's not a professional athlete, but we have a video recording of someone who had overcome stage 3 cancer, and I thought it was so powerful that he said he was able to overcome it because of his mindset more than anything else. So it's something that we really cannot undermine or minimize at all. But just knowing that looking at you holistically, looking at the entire picture is extremely, extremely important. Anything to add?
yeah, I totally agree with that, and I'm so glad you came up with this protocol because I take care of a lot of cancer patients. And what I found out my role is, it's not, a lot of times the oncologists, you know, they're doing the chemotherapy, they're on their pain meds, but life still goes on. Like a lot of people that have cancer are still going to live very, very long, like, very normal lives. And I was telling one of my patients that don't succumb to this disease. Don't. We talk about identity. Don't let this disease become your identity, and you're like, this is it. You're like, you still have to check your A1C. You still have to get your screenings done. You still have to talk about your mental health. And he's seeing a therapist. He wanted to be on antidepressants. That helped him. He's still checking his A1C. We're doing the colonoscopies. He's and I think because of that he was doing better because like he only had one problem on his past medical history list versus like three more. I always tell a lot of my young friends that have maybe some autoimmune condition. It's always best to have one thing on your one liner, as doctors always say, 60-year-old male or female, past medical history of blank comes in with. It's best is one thing versus two or three things. That's why I tell a lot of my cancer patients that like don't let this cancer don't let it um, change you. Don't let cancer be your identity.
That's so powerful what she said because I didn't even think of it that way. I'm like, wow, that's true. Because it can really shift from one thing becoming your identity to this diagnosis now becoming your identity. That's powerful. Wow, that's really, really good. Uh, so we hope that this was helpful. We hope that it was encouraging for anyone who's listening. And if you are currently going through this, don't let this become your identity. Don't let it cripple you. Don't succumb to the diagnosis. Know that there's help available. We would love to meet with you, have a consultation, and frankly go from there. But know that there are a lot of options that are available. And as Dr. Tim said, life goes on, right? A lot of people are able to literally have thriving careers. People actually believe that sometimes after they go through something that life altering, then their lives afterwards are actually better. And I think it's because of how they change in the process of dealing with whatever it is. Just priorities change and all of that. So, anything else to add before we wrap up?
Yeah, that was a good talk. I'm so glad you have this protocol. You know, I feel like a lot of clinics they don't have you have a cancer patient with a cancer diagnosis, but sometimes a lot of clinicians also succumb to their patient's disease. Okay, this is a cancer
Yeah.
patient.
Wow.
These
Yeah.
substance. I'm really I thank God that you really came up with this protocol to help people, and I think it will change a lot of lives, help out so many people.
We thank God. We thank God by God's grace. Well, thank you guys for tuning in. Make sure you subscribe and share this video with at least 10 people.